next question is related to psoriasis. When I was young, I never heard of psoriasis. Nowadays, we are hearing it. It has become more common, doctor. And person who has shared, he has shared pictures also. He's having psoriasis for 5 years, and earlier with cream it used to subside. Now even with creams it's not going. I think past few months, and now it has started spreading to his thighs and all.
Okay.
So he's asking what he should be doing for this.
Okay. Fine. So psoriasis, the exact cause for psoriasis is not known. What causes it is not known. Some studies say it could be because of genetic predisposition. Some studies attribute it to environmental factors, but basically it's multifactorial. The exact cause is not exactly known. But what is known is what exactly is happening in psoriasis. So to simplify it takes about 4 weeks or a little longer than that for new skin cells to get produced at the bottom of the epidermis and to reach to the outermost layer of the skin and then to get shed off. This happens very gradually and it is not noticed. In all the psoriasis lesions on the body, this entire process which happens over 4 weeks or so is happening over just 72 hours, just 3 days, which is why we see a lot of this powdery substance getting discharged from the normal skin and a lot of thickening of the skin on the palms and soles. So, we don't know what's causing it, but we do know what the triggers are in a person who has psoriasis. Because psoriasis is something that is going to stay with the person for life. There is no treatment for it, and it is very important for the person with psoriasis to accept it right away, that this is not going to be there for life. It's not going to get cured. So at that point it becomes easier to manage it. So there are a few triggers. So what are the triggers? Dry skin. Dry skin easily breaks into psoriasis, so one must always keep moisturizing one's skin. Even psychological stress will cause a psoriasis flare. So one must try to keep calm. That's easier said than done, but stress does cause psoriasis to flare up. And then people who smoke. Now smoking is associated with more number of flares and a 20% higher intensity of psoriasis. So people who smoke should quit smoking right away because that's not going to help with psoriasis at all. And food, the consumption of high glycemic index food. So this is food on whose consumption the blood sugar levels in the body suddenly spike. So basically junk food, sugary food, oily food. So not having this kind of food and eating healthy will help in having a lesser degree of psoriasis or not having psoriatic flares. And psoriasis is basically a lot of inflammation happening in the skin. So if one is obese or overweight, it is very important for that person to lose weight and become physically active. Because when one has more amount of fat cells in the body, the fat cells are always producing some inflammatory molecule that will keep triggering psoriasis to happen. So staying fit, eating healthy, all of these are things that one can do to keep psoriasis in check. But what does one do when one has psoriatic lesions? Well, so one palm surface area is equivalent to 1% of the body surface. So as long as it is less than 6%, as long as it is less than 6 palm surfaces, we can always use creams to manage it. Whatever cream is given, the patient must use whenever there is a psoriatic lesion. No need to consult the doctor again and again. So when do we think of tablets or injections? Well, we think of it when it crosses 6% or when there is an involvement of the joints. Psoriasis can also cause inflammation of the joints of the fingers. So that should be considered an emergency. A person with psoriasis with any joint pain must always let his doctor know that this is happening. So that's again an indication to start the person on tablets. So what are the tablets that we give? There are a lot of these tablets. One of the most effective and widely used and safest ones could be methotrexate. It's been used for decades now and just involves an initial workup to make sure that the patient doesn't have any existing infections, because psoriasis is an inflammatory process, so we try and control the body's immune system by giving these tablets. That means the person's immune system will be slightly compromised. So it's only after ruling out a few infections that we start them on these tablets. These tablets can be taken for years together, decades together, with proper monitoring. So there's methotrexate. If that doesn't work out, we have other biologicals. We have something known as etanercept. We have Premilast. A lot of these biologicals, again, there is no proper protocol for what to use after what. If methotrexate doesn't work, everything else is trial and error after that point in time.
Okay. Yeah. Thank you, doctor.